Afternoon and welcome to the Minister's Press Briefing here at the Ministry of Information. As you are aware, the world is battling a number of pandemics. We talk about COVID-19 pandemic and quite recently about the Marburg, monkeypox, among other things. Today we have the Director General of the Ghana Health Service and his team to give us updates on the cases when it comes to our country, Ghana. So with us this afternoon, we have the Head Expanded Program on Immunization, EPI, Dr. Kwame Amponsa Achiano. With us also is the Director Public Health at the Ghana Health Service, Dr. Franklin Asiedu Bequin. We also have the Public Relations Officer of GHS, Mr. Jacob Akwa Ando, and of course, the Director General of Ghana Health Service, Dr. Patrick Kuma Abuaji. We'll go to him for his substantive presentation, and as always, we will come back to you for your questions. Thank you.
Thank you very much, Deputy Minister. And good morning, good afternoon all, and our friends from the media. As the Deputy Minister announced, today we'll be talking about the three key areas of public health concern that we are dealing with. As you have been following up lately, the whole world is being confronted with epidemics, and most importantly, transfer of diseases from animals into man because of the invasion. And so it is something, so Ghana is not very unique as far as this is concerned. Today, I'm going to take you through the cases that we are looking at. That is Marburg virus, which is the latest we are dealing with. Update on COVID-19, the cases, epidemiology, and the vaccination. The monkeypox update, and you are aware that monkeypox have been declared yesterday as of public health concern globally. And so we all need to be on the lookout to see where we are as a country within that context. The COVID-19, as we are all aware, has presented us with a major challenge, and that has stressed the public health system in this country. The current wave of the COVID has seen, however, a downward trend compared to our neighbors, and in the last few weeks, the numbers have significantly come down. We hope that it continues that way, and we'll come up with measures that has to be done to continue the downward trend. We are further stressed with others like the Marburg, the monkeypox, and of course we're still dealing with COVID. And there have been other pockets of the usual outbreaks of poliomyelitis, because we found some viruses in our sewage, environmental district. That will mean that we need to sit up and quickly protect our children. There's some few cases of yellow fever and measles, which are all minor, which has been actually been taken care of, and we are continuing to engage that. Now, let's turn our attention to Marburg now. On the 26th of June 2022, we identified a case of viral hemorrhagic fever. That is a case of fever with bleeding. That's the broad definition from the various orifices. Noguchi confirmed the virus was a Marburg one with Marburg virus disease on the 7th of July. In line with our protocol of quality assurance and the fact that Dakar, Institute Pasteur Dakar is the expert area in terms of hemorrhagic disease, we sent samples to Dakar on the 15th, and the results came on the 15th July that one was positive, one was not corroborated, as the second case was not fully corroborated. Well, we managed them as positive anyway because we have a positive case from Noguchi. That is, they gave us the first two. For the second case, A follow-up of the case, the clinical notes does not fully suggest that a viral hemorrhagic fever. He was a case of chronic peptic ulcer. And so further investigation is being conducted to do an additional test because the body has not been buried, and then we'll continue to see whether we can confirm that or not. All the contracts of Marburg, as we started originally, have completed, as the 118, have completed a 21-day quarantine, which is the mandatory quarantine that we follow up. And we've also implemented interventions focused on the 3 regions, which I will show you. That's Ashanti, Savannah, and Western region, where 3 districts in that area. We have had a cumulative contact list of about 318 contacts in the 3 regions. Ashanti had 50, Savannah 48, and Western 20. 19 of the contacts were health workers, 99 were close family members or household or community contacts. And all contacts, as I said, has completed the 21-day as we speak. So if you see the map there, we have the Solatuna Kalba, which came into view because in the early phases, the first case was sent there and buried. And so during the burial and we had contacts there to look out for. We also have the Adansi North and to some extent Bekwai as the area of concern in Ashanti region. And then we have Western region, that's Pristia Huni Valley district, which is where the first case fell ill and came from. And so that's our main source of concern, that they may have been the source of the infection because the person was ill there before moving to Adansi, where within 3 days the system picked it up. Unfortunately, one close contact reported symptoms after the maximum incubation period. That was after the 21 days, reported some symptoms and died on the 21st of July 2022. This, for the sake of the family, these are very, very close relatives or members of the deceased, where under normal circumstances they are higher risk. But what is interesting here is that it came after the 21 days quarantine. So we've taken samples and following up with them. Currently 40, so because of that, the initial test had come up as positive for that close contact. And we have identified 40 additional contacts within the Savannah region where the incident occurred. 11 of them are health workers, and 11 out of the 40 are health workers, and the rest are other new members, including patients. Well, after the time, the patient had been discharged from quarantine, but we're still monitoring to see. Daily temperature in general health and well-being is being undertaken by health workers in the affected districts on daily basis. So we have instituted additional public health measures. These are, we have alerted all districts in the country to be on the lookout. And I must say that it's a very, very high sensitivity area. So we had a couple of cases that come close are tested, but so far we've had no positive outside these places. We've also the community engagement and risk communication, education on what to do, what not to do as part of the protection has also been done on, and then further investigation continue to go on to look at the main source of the condition. We've also constituted a rapid response team with the support from the regional and district response team to detail the investigations that are going on. We have looked at the clinical records. What we do is that we go to the facility in the area, look at anybody who has come there, because it could be missed, with symptoms that come close to that. And then we look at about so far, everything is fine. That's apart from the 2 cases, we have not had any one that comes close to that. We are also supporting them with contact tracing, and we have supported them with PPEs and other logistics to ensure that they are able to conduct their work more efficiently. We have developed training tools and education materials, especially for the district of concern, the region. We are training more surveillance, community-based surveillance. These are the people who hear somebody is not well, somebody is vomiting, etc., and tell us. So those are very, very key tools we have in identifying cases. We've trained about 60 community-based volunteers across the country, and more additional training continues to go on. And then we've also developed a national response plan to deal with the Marburg disease. We have identification of community of interest in the listing of contacts. We've heightened community-based surveillance, as we said, and district-based orientation of health staff and standard case definition. That is, the case definition is what are the things that you will see that will make you draw the conclusion that we will need to take a second look at this person to make it much simpler for us. We are also doing public sensitization through radio and community-based services, including this very update that we are going on. Further investigations will continue. As we continue with the further investigation, we are going to enhance community engagement, because that's very, very important that we are able to pick it up early. And I must emphasize that the key to addressing this is early identification, so that that person or whoever cases does not spread it before you start chasing the cases. And that has been the strength that has helped us identify it so early, and in 21 days we still are where we are. We have decided that we are going to continue monitoring all contacts for 42 days, just to be on the safe side. Offer psychosocial responses, support to their families, and it is very distressing. Of course, not everybody will believe that there's a virus called that, but they also think that, is it a curse? Is that something from where? And so we are giving them support in all aspects to ensure that the community stays safe and they are able to follow the contact tracing arrangements that we are doing. We are training community-based cases to do search and contact other contacts to be traced. And then we are going to do an environmental assessment of the wildlife affected district, that is Adanse North, Bekwai, Pristia, Huni Valley. As we said the last time, it is the fruit bat that is the main host of the virus. The bat can live with the virus without falling sick. But if he jumps into a human being or a primate like the large monkeys, etc., then it becomes a problem. And so we are looking at that. And we are collaborating with wildlife to ensure that we are going to do a national risk assessment to see, are there any other places in the country where surveillance must be enhanced, because the risk of contracting that virus is high. And so this is just an eye-opener, and we are using that opportunity to also build our systems to be able to respond early, irrespective of where the threat may come from. We suspect that the virus may be lurking around the sub-region, and so everybody needs to be very careful. And our bats migrate and come back, and so we need to watch all those things. Okay, so that's it for Marburg. I'm sure we'll have a few more questions from that. So going back to COVID, which is still remains a threat. And as you have seen, other countries are seen increasing cases with a new variant, the new Omicron variant in other parts of the world. But we have seen a decline in the last few weeks. Greater Accra still remains the region that accounting for the highest proportion of the reported cases nationally. Apart from yesterday, where I think Central Region had a higher number than Greater Accra. COVID-19 among those arriving international are still very, very low. 4 regions, Western North, Northeast, Savannah, Upper West, do not have active cases at all. We've had 12 deaths reported between the 1st of June to date, and 6,198 cases have been recorded over the same period. So the active cases now has dropped to about 336. Currently, we have only 1 severe case, but there's no critical case in the country. So you can see that this is the normal, usual graph. You can see there's a downward trend now, and this was a relatively lower curve than the previous Omicron one. And the active cases continue to drop as usual, and so we'll not spend so much time there. Now, total vaccines administered. May 31st, we had about 15.9 million. As at June 30th, we had about 17.4 million doses given out. And as we speak, as at July 20th, we have moved about 18.4 million doses across the country. And the last time we showed you this chart of regions with the lowest coverage. The yellow ones are those who are doing less than 25. You can see that May, June now, in the last one, there's no yellow map in any of our regions. So that's a good sign that uptake is increasing with the periodic campaigns that we are doing. If you go to the next slide, you can see that there were a lot of yellows in the districts. That has reduced significantly in June, and in July, as of July 24th, the number of the yellow slides have significantly come low. We have seen that our parliamentarians have also joined the campaign, ensuring that people will take up the vaccine. I think that will be very, very helpful for us. So that's it for the vaccine uptake and COVID. Finally, Honorable Deputy Minister, I want to also finish with monkeypox. As we are aware, WHO has declared it as public health emergency of international concern. Ghana has so far recorded about 34 cases. The last confirmed case was on the 15th of July. After the last breakdown, we had about, of the 30, we had the first 30, we had about 20 of them from Greater Accra. We have one in Bono East, Bono, Upper West, and Ashanti region. So these are the regions who are reporting cases. So far, no fatality among cases have been reported, and the majority of the cases are males. So you can see with a chart, the map showing where the cases really are. We have them in Upper West, Bono East, Bono, Ashanti, Eastern, and Greater Accra. Greater Accra accounting for about 2/3 of all the cases that has been reported. So district rapid teams, as usual, and case management teams have been oriented on how to identify and make a response. We have also disseminated WHO guidelines on case management and how to do when you have a case of monkeypox. We are working with the Veterinary Services Department to conduct assessment in affected communities to look for what are the possible causes so that we can identify possible contacts and those at risk and protect them. Contact tracing and follow-up, and we have enhanced education in schools and communities as far as monkeypox is concerned. Very easy to mix it up with chickenpox, and so education is extremely important. So what is the outlook for us? The public health system is currently being strained and stressed with all these emergencies that is coming up. But I must say that the system is holding, and thanks to the community and the system that are in place is happening. I think the only trump card, the main trump card we have here is the fact that the system is able to pick up things very, very early than, and I think we may have picked the first monkeypox even before the announcement became a public health emergency as was on. The risk of widespread monkeypox exists but has not posed a major threat. The threat of Marburg virus that will spread exists but is very low. The chance that it will spread is low because we've done since the 26th of June up to now. If it was going to be an explosion, well, we should start seeing a spread from those initial contacts who may have passed it on to others. But like I said, the risk is there. The host is in the country, and so the possibility that it can be jumped into anybody is important. So we continue to be on the lookout for that. So to look at that is to prevent all that is adherence to protocol is extremely important, and infection prevention and control strategies, including personal hygiene. Marburg is a close contact. If you don't come in touch with flu, body fluids, etc., you won't get it. And so how do we look at that? And we must also commend our health workers in the fact that when they encounter the case, because of the infection prevention approaches they have so far, we don't had any health worker who has been affected. Usually, such cases is the case, and the next batch of people who makes affected are the health workers, the first responders who are going to look at them. But in this case, we have so far not had any condition appearing from them. The surveillance activities will continue to be strengthened so that we can make sure that early detection and adequate containment is ensured. So thank you very much, Honorable Mr. Paul.
Thank you so much, Dr. Patrick Kumar Boaje, Director General of Ghana Health Service. You heard him, and the takeaway really for me is the fact that if you have come into contact with anybody who has any of the viral infections, do not hide. Early detection, or if you report early and through the surveillance system, they are able to get you and contain it. That is how you can protect yourself, your family, and your community. So with your cooperation, there is so much that the Ghana Health Services can do. So ladies and gentlemen, on that note, we will take your questions. If you have any question on the monkeypox or Marburg or COVID-19, as the Director General presented, kindly show by hand. We will bring the microphone to you for you to ask your question. Yes. Okay, I can see another hand at the back. So we'll take one, and we'll take two. Okay, and Sarah will be the third. Okay. I saw a hand. I think that was Philip.
My name is Solomon Babiji from The Finder. Now that the monkeypox has been declared a global emergency by the WHO, are we going to have any special protocols established for it as we did for COVID? Thank you.
Thank you for the question. We'll take the second one.
No, good afternoon.
Good afternoon.
Bacho Femi Opoku, Mifri Kingdom FM. Bacho, the question here boiled down to what Mebrani asks right now. Yeah, but say a month for raising issues, COVID protocols, something that we should still observe. Now, President should come out again, saying who say COVID now on here Kasano, because the last time on here Kasafa COVID here March 27th or something. So he should come out again because free that time until now, you have two different virus so far some can't be one. So he should come out and come and reinforce the COVID protocols now. So we want to find out from Doc said, is it important for the president to come out and speak on it, and what does he make of that? That's it.
Okay, that's it. So we'll take Sarah's question.
Good afternoon. My name is Sarah Apenkra, report for TV3 News. I have just 3 questions for Doc. Please, I want to find out the new case that died on the 21st of July. Does that officially make our case 2, as you claim the one who is yet to be buried is yet to be confirmed if it is Marbeck? If you can clarify that for me. And I also want to find out the one whom had died. Has the person also been buried yet? The monkeypox, can you please help us with the specific districts in the Greater Accra region where these 20 cases are being recorded, considering the fact that you gave us the district for Marbeck, which informs the people around that enclave to be extra careful? Thank you.
Thank you for the question. We can take more questions if you have. This is the best time to ask. So we'll take one from here and another from the back.
Right, my name is Obed. I report for GH1 TV. So on monkeypox, during the presentation, you spelled out that 34 cases have been recorded so far. Even though you mentioned that you are in touch with the veterinary services, we want to be sure how strong our veterinary services, especially where the map showed that the upper west is also affected. We want to be sure how information is going down in such areas. Thank you.
Thank you for the question. Okay, we'll take 1, 2, and then go for response.
Yeah, thank you. Arthur Mensah from Ghana News Agency. Yes, as the Director General said, we are currently faced with 3 viral infections. And I want to quote him, said, the public health system is stressed. So I want him to explain. Maybe the system is stressed. One, maybe there's a lack of finances to deal with it, or maybe there's lack of materials to handle it. If you can give further explanation as to how stressed the health system is. Thank you.
Thank you for the question.
Yeah, good afternoon, Dr. Boji. I want to know why this streak of diseases happening simultaneously. Is it because there's a wet disorder, or what is the trigger? I want to know what is triggering all these diseases coming at this time. And then, if you remember, in the era of the COVID, health personnel, some of them suffered some attack. I don't know. Can you give the figure of those who survived and those, if you can give those who passed on, because you want to be sure of what they went through, so that they may have some kind of situation in mind. I don't know if that is possible to give. Thank you.
Thank you for the question. Okay, we'll take John's question as the last.
Yes, my name is John Awuni Kesben. Doc, when you were doing your intro, you said the Marbeck virus is a hemorrhagic fever. I want to know if the Marbeck and that of Ebola are of the same, because Ebola, I understand it, so it has something to do with hemorrhagic fever. Thank you.
Thank you for the question. So we'll go to the Director General for his responses.
Thank you very much. I'll answer, and where Director of Public Health wants to add, he also come in to add. The protocols for monkeypox is close contact. And so what we have actually mentioned is the fact that anybody with those postular symptoms, you don't touch with your bare hands, with trained health workers and other people. And the protocol is that as soon as you see such, please report so that I don't spread it among others, so that we can also find contact. So basically that's the protocol. But the main thing is basically personal hygiene. If it's improved, the chance of it transmitted from one to another is, like I said, it's very, very close contact. That's how it's transmitted. Mr. Poku, I'm sorry, a question in there, and I'm going to Deputy Minister by answer, but I think maybe a President can host in Biano adherence to protocols of COSRO. Intimation on one in its right time, of full cells or obey. Me should say on one about new Biana catches on me. I'm sure someone's hosted system. No, I'm sure Minister, Deputy Minister might add to that. The the new case, Sarah, your question was, okay, let me answer the monkeypox one. You want to know where in Accra they are? Okay. I don't know whether it's for personal reasons, so that you know where to pass or you know where not to pass. But in Accra, there's a lot of movement around. So even if I pick one in Kaneshi, you never know where that person goes across. But it's mainly in the main Accra municipality. That's where we have it. So if we say it's in Teshi and it works in Nungwa, it doesn't help you. But the most important thing, let's all protect ourselves. So the new case, we'll clarify whether, yes, the new case had actually completed the quarantine. And so the baby had been buried. This was a malnourished child, 14 months old. And so it's been buried, but we had samples that we are using to do the testing. So that is where we are. And that's why we have all those contacts to follow up on. You had 3 questions. What was the first one? I know about the buried, one was buried.
So, Doc, I wanted to, you said the second person who died from the previous 2 suspected cases is yet to be buried.
Yes.
And
yes.
it has not been confirmed if it is Mabe.
Yes.
So is it that officially we have 2 confirmed cases, which should have been 3 if the first 2 were confirmed? I just needed a
Well, I will say officially, we have 1. We are yet to corroborate the new ones from Institute Pasteur. That's our protocol. So we say it's a probable case. So once we get the confirmation, we will see. The second one, the second or the first, we are taking another sample tomorrow and send to Dakar to see what to do with it. So that's what I will say. So based on our protocol, after Noguchi, we'll do quality assurance with Institute Pasteur, and then we'll come out with. But in the meantime, we'll consider them as cases and manage them as such until we get the final confirmation from Institute Pasteur. First, it's just a quality assurance. This is not to say Noguchi is not doing well, but it's a protocol that we do for quality assurance purposes. The next one is, yes, we are working very much with the veterinary service because one of the Marburg, the monkeypox, another zoonosis, and so it moves from animals onto man. And I believe that the veterinary services everywhere, our collaboration to see are there cases that they are seeing, how do we manage them, how do we prevent transmission from one to another. How stressed is the public health system? Yes, the public health system is stressed in the fact that people are working around the clock. Because the same set of people who are dealing with all these cases, it's not so much of logistics. Occasionally we have logistics, but we tend to get support from the government and our partners. But as far as the work is concerned, we are all running around, and so we are making sure that we can see that people are really getting tired because they are moving from case to case. And as I speak now, people are in the villages following up on contacts, among other things. So that's what we say is stress, except that we must acknowledge the public health workers that they are doing their best. They are actually putting out their best. And in all the time we ask them, there's this issue here, they are on top. And I think that is why we are able to pick up cases very early. Because if you don't pick these cases very early, the next thing you hear is that people are dropping dead. And by the time you get there, it's too late. And so when we say stress, those are the issues that we are talking about. COVID survivors. But I think we told you the number dead. I don't get who the survivor, what is the number. We had 1,445 deaths. And we said the last 6 or so weeks, we've had about 10 more deaths. The health personnel, yes. I mean, we lost a few. Some got ill. But all of them have returned to work. And there's some compensation processes are ongoing because there were some insurance processes that are currently being worked out. So that's what I can't tell you the number, but we had a significant number. The last time we checked, we had about nearly 4,000 health workers were infected. And so we're dealing with all that. Ebola and Marburg, they are from the same family. They are from the same family of viruses, and the same bat is the one that carries them. And they present in a very, very similar way, such as bleeding, high fever, body aches, general malaise, and then bleeding from all the orifices in the body towards the terminal end of the disease. And so the only difference is that Marburg is rare compared to Ebola. It's more common. But Marburg has a much higher death rate. It can go up to 90%, which means that about if 10 people get it, it is likely that 9 of them will die, compared to Ebola, where it's up to about 5 out of 10. So those are the differences. Marburg is rare, it's more virulent, it kills faster, kills more than Ebola.
In the group, can you give us the underlying reasons?
Why?
I mean, having this disease one after the other.
Okay.
Yeah.
I think most of them we call are zoonosis. There's also the talk that the fact that we are probably invading the space of the animals, with all the development and all the encroachment, etc. And so with our lifestyle, we are now more closer to the animals than they used to be. And of course, previously, if you got Marburg in your farm, you will die. It may never come to anybody. Ebola may kill you. COVID may have killed you before getting out. But now today, I have COVID this morning. In the next 25 minutes, I'm in Kumasi. Isn't it? And then I'll continue to another town. And so it spreads faster. It took 70 years for smallpox to spread to the whole world. In COVID, it took less than 3 months to spread to the world because of the way we move. And so those are some of our lifestyle and our movement pattern and our cross-border actions are the ones we're facing. Where we are suspecting that the case of the Marburg may have originated from, we continue to. I mean, these are areas where you have some level of galamsey going on, etc. And when it's galamsey, you don't have only Ghanaians. There are other people who are crossing the border into those areas. So these are all the risks that we face as a country that may also, we are also preparing, and that's why we are building our port health stronger to be able to provide some barrier in all those areas to help us. So it's the current way of life that is making the situation spread very fast. Over. Thank you very much.
Mr. Opoku from Kingdom FM. Ubisa says nka sene COVID by na Ghana mampenyi president na Adanko Akufo-Addo one Ghana fo bedi nkita ho hye omunkran no esese nka Marburg ne monkeypox abai o hwe nim so beba bekasa na meka kakra aka ne Director General of Ghana Health Service kan no ho a na me sisuduan say asem na wo bisa na ne kwan so ano na emomu no president beto na num to ababeka bibia fire a esan a etimiti atese wa amansan nyina ho no na ejina bia afutuo anase nimdia eye omomo eye apomudin adwuma mo ye kukudam omo ye abode mu mpensempense mu ne ade a omampanya aka omo nyina abom e de aform COVID task force no se omo hwe na yare na hoden ne se ne esi ehitafa na duru bebi esese obekasa omutu no fo abribia no nipemu a obeba ne abetwetwe nkomo na medema no si nso ne se da ubo no emugumu ahodo se ne ewa wonim no bra no Director General of Ghana Health Service one mpenimfo akuku dambe pie ha na omo beje mu nsemi nyina na omo yi ano sa nso so ne to da ya nso so yetime hyehye anu ye ni bi egu ebia fidie so ne de ama mo media houses ahodo na omatimi abo de nkyerɛkyerɛ ama Ghana de hye nyina nti sɛ brepam sɛ omohwɛ na bebia yare no epem kɔ no ehu behia sɛ omampanyin di anu ye beba ana sɛ ode nsɛmu bebebre Ghana man nyina megidi sɛ nyame ado eduru hɔ no ma ebeba. Distinguished ladies and gentlemen, okay, so please, if you have any follow-up question, if not, okay, I can see Sarah's hand. If you have any follow-up question, you have any other question, this is the best time to ask, as we take this to be the final round of questions.
Please, DG said there's going to be an environmental assessment at Adanse North, Pristia Huni Valley, and also a national risk assessment. I want to find out how soon these programs are going to start, considering the fact that we do not know the actual source of these viruses into the country. And I also want to find out the first update we had on monkeypox. We said it wasn't time yet for a vaccine to be called for into the country. Do you think we are getting to the threshold where we need to be looking for the vaccines of monkeypox? Thank you.
Thank you for the question. Please, if anyone has a question, this is the best time to ask. If not, I take that to be the last question for the day. Okay, so I'll invite Director General for him to provide responses.
Thank you very much. We wanted to know exactly how many cases. Like I said, maybe Director Public Health will explain. One is the fact that we have 3 confirmed cases, as we have said. We are virtually waiting for the verification based on our protocol to send 2 more of them for validation to confirm that that's what it is. In terms of the monkeypox, we are working, the environmental assessment for Marburg. One, we need to identify the source of that, as is the localized assessment that the wildlife already has been to the site, and they are going to work with our partners and other experts to see, maybe they'll have to get a few bats to see whether in that enclave, are there bats carrying the virus? Are there animals that have contracted the virus? That's what they're going to do. So that's currently ongoing. They had a meeting on Friday, and they are preparing to go to the field. And I must tell you that the wildlife has already done some assessment before. They are only going to do one. The next one is that to ensure that this happened in one enclave. It could happen anywhere in the country. So they are going to do a risk assessment. Fortunately, I think they know where all the bat colonies are. They will look at all those things and see whether in this area, is there a risk of such a thing happening? Are those, where do the bats migrate to and return from? These are all information that I'm sure probably at the next one we'll bring the wildlife to also explain to you exactly how they're going to do. But it's a question of a risk mapping to see that in this area, the chance of someone contracting, that will going to help us in looking at our risk communication and our surveillance, so that we will know where we have to heighten our surveillance for those disease conditions across the country. Director of Public Health, do you have any other further? Okay, so thank you.
That brings us to the end of today's press briefing. Friends from the media, distinguished ladies and gentlemen, thank you so much for joining us on a Sunday afternoon. Have a blessed weekend.